All right, let's move on to the last question. This one's a little interesting and different than the other four. Is there a link between multiple personality disorder and SM? My 17-year-old brother, out of the blue, stopped talking to his close family in late 2022. He also doesn't talk to anyone that a family member is close to, for example, my boyfriend. Yet he still talks to his close friends at school. We have taken him to many therapists and have done many tests, and we still don't know the answer. He also has severe OCD and anxiety, and he has told his therapist that there are different voices in his head that control his mind, kind of like the movie Inside Out. Have you seen anything like this before?
Wow, there is a lot here. I don't I do not see a link between multiple personality disorder and SM. Can you have multiple personality disorders and SM? Absolutely. In the course of my career, how many times have I seen it? I can't think of when I have. I did have a case or a few cases where some of the older individuals had schizophrenia, which was part of their presentation, which they were hearing voices. But again, this is an outlier, Brand. I want to be very clear to our audience that there is not a link. I've never seen a link, and I would think my 35 plus years of experience would tell you if there is a link. When I come up with things like the whys of SM, the factors into the development and maintenance, yes, I've seen those links, which is why we studied those links. There is no link between that, but they can exist. I also would say, like, how do you know he has multiple personality disorders if all that's been said is that he hears different voices, which is a big deal? What comes to my mind just from that is schizophrenia. And being 17 years old, you can have signs of schizophrenia. So to me, I'd be looking into that. Now, the stopping talking in 2022 may have nothing to do with any of that. It may have been something going on over time. Sometimes when someone has selective mutism and there's a lot of push to speak or a lot of pressure, a child may stop speaking in his home environment due to that. Maybe there were changes. Maybe there were environmental factors that caused incredible stress in the home environment. A move, a family, again, multiple types of stresses, divorces, deaths, major changes, that can cause tremendous stress. I have seen individuals with SM stop speaking in their home environment, which was associated with the stressors, environmental stressors, pressures in the home environment, but speaking to friends in other locations. So family therapy here, or at least figuring out what might have been triggers into the stopping speaking. If his voices are telling him don't talk at home, then there's a schizophrenia component or another psychiatric disorder that needs to be figured out where he's being told don't speak. But again, that's not something I see. So I go the route of, is schizophrenia or another psychiatric disorder compounding this? Possibly. But I
Yeah.
would try to break it apart and see what may have been occurring around 2022 or prior that may have caused him to be shut down and may have caused him to stop speaking in the home environment.
Yeah. It's an interesting question because it makes me think, is there like a teenager rebellious aspect to this where he's just like quote unquote hates his family and they don't understand him kind of thing going on here? Or is it linked with SM or linked with multiple personality disorder or not? What are your thoughts on that?
Well, I don't see the I want to just pull out the multiple personality disorder because I can't talk on that. I'm not seeing that here. I don't know what that is in terms of his presentation, what are aspects of multiple personalities. If they're basing it on the fact that he's not speaking at home but speaking everywhere else, and that's the basis for this perhaps diagnosis, or was he diagnosed with multiple personality disorder? Does that individual that diagnosed him understand what SM is, so that his multiple personalities are, I'm not speaking at home but I'm speaking everywhere else? No, I don't see it that way at all. And I'd hate to have that diagnosis if that's not truly the case. So again, I don't know, and I want to pull that out. Can teenagers feel misunderstood at home? Absolutely. I wouldn't use the term hate their family. It could just be feeling distant, disconnected. Did this family again go through some major life transitions? I've had situations where parents have gotten divorced. Another parent met someone new and they really didn't want to, they didn't feel comfortable with that person. They were living now with a new person that they didn't feel comfortable with. That they now stop speaking to. Maybe they have some or discontent with a particular parent. Again, I don't know. That has to be investigated. This is like throwing a lot of things in the air and trying to figure it out. I don't know. There's lots of questions I'd have for this family as part of the evaluation process, and helping him deal with what that might be, and working as a family to figure out what else, could be dealt with in family therapy. I have seen a lot of that in families where the child just stopped speaking he wasn't old. In 2022, he was 15 years old. So what happened within that family dynamic that caused him to stop speaking in the home environment, but he is talking to his close friends?
Yeah. Yeah, it's an interesting question.
Yeah, there's something with the family there.
So family therapy is what you would recommend?
Well, just figuring out what is it. Like, he may not even know. So being able to learn what is it, and then the family's being receptive to, look, this child stopped speaking. There's obviously frustration on his part. Is there some rebellion going on? Possibly, but I don't usually like to see kids with SM kind of cornered into oppositional defiant disorder. You know me. Right. I feel like that's a really wastebasket diagnosis, and it's usually a result of their own inner frustrations rather than that's causing all this.
Yeah. I think that's helpful for the listener who asked the question.